Hi, it's Dr. Keith McAfee. Welcome again to Medicine and Faith, where I take a subject of medicine, teach about it, and relate that to our faith. Today, we're going to talk about, it's a long word, lightheadedness, to become lightheaded. That took up half the time just writing that down. Lightheadedness, when we stand up too quickly and we feel a little bit of faint. Now, I want to start this out, if I can, with a big disclaimer. This is not for someone who really feels like they're going to faint or tends to faint. This technique I'm going to teach you today, don't use that. If you really feel lightheaded and like you're going to faint, fainting is not a good thing, trust me. You get down on the ground, you sit back down, you lay back down. Don't stand up trying to do some compensation because you're going to faint before you can get it done. But let's talk about what happens. Okay, lightheadedness. I've talked, and I refer you to my high blood pressure lecture, Hypertension. But let's talk briefly about the blood vessel. Here's your blood vessel, okay? And here's where the blood is inside there. So the blood's in here. And you've got a muscle there in this blood vessel that's always, okay? It's a thick wall. Remember, veins are very thin-walled, arteries are very thick-walled. That muscle is always a little tiny bit tense. I called it relaxed tension, where it's not completely relaxed, it's not completely tight, but it's sort of in that happy middle zone. If you relaxed all your arteries and veins at the exact same time, your blood would drop somewhere down here because you don't have enough blood to fill up all your body if all the veins are completely dilated and open. So they have to be just sort of in that happy medium, okay? Now, let's say you're laying down flat. Now, there's no real gravity on your bloodstream because your bloodstream is pretty much like this. And so all the muscles, all the arteries are horizontal, and so they don't have to hold any pressure, and so they're nice and relaxed. Again, they're in that happy medium, but it doesn't take a lot of strength to get in that happy medium. And now suddenly you stand up, okay? Gravity then instantly starts pulling down on that blood and pushing down towards your legs. Now, the leg arteries, the poor folks, they've been sitting there nice and comfortable and relaxed, and suddenly you stand up and they feel all this pressure of blood coming down to them, and they have to tighten to get back into that happy medium because they start to dilate at first, and they have to push back and get the blood up, because when you stand up and the blood starts to kind of pool down towards the lower part of the body, the blood pressure in the brain drops. I don't mean it empties the blood. I just mean that the pressure drops, and so you get a little lightheaded until those arteries can kind of push all that blood back up and get the pressure back up here. But that, of course, is a lag time. It can be seconds, it can be actually minutes, but you need that time. And that's what happens when you get lightheaded. Now, how can we fix that? Well, it actually has to do with how you breathe. Let's do this. So here are your lungs. Okay? Very bad artist, but here you go. And the lungs, of course, have ribs. And these ribs come around from the back, and they come around to the front, right? You got all your ribs, and they have muscles in between. And then you have your diaphragm down here, and you have your chest wall. And this is your thorax, your chest, is actually a closed cavity. Because how do you breathe? Just think about it. How do you breathe? Your chest expands out, your diaphragm pulls down, and it creates this bigger volume in your chest, and you create a suction. And you vacuum in air. You've heard the phrase, nature abhors a vacuum, or nature hates a vacuum. It'll fill it with whatever it can because it doesn't like a vacuum. So that's all expands out, and this goes down, and you create this big space, and then you have all this air, and the air just comes right in because air is easy. And it goes right in, and you fill the vacuum with air. And that's how you breathe. You suck air in. Now, what happens if you create a big vacuum in your chest and you don't let air in? You create this vacuum, plug your mouth, plug your nose, do it hard, and create this huge vacuum, and don't let air in. It's a vacuum. It'll pull in anything it can find. Well, there's only one other thing that there is to pull in, and that's blood from the bottom of the body. It has to pull something in, or wants to pull something in, so it'll pull the blood in from the bottom of your body and help relieve the pressure of the arteries trying to squeeze. It'll help facilitate getting blood up. Now, what happens to blood that goes in? It goes straight into your heart, right? And it goes from your heart, then it goes up to your brain. Because the heart, of course, the poor heart's sitting there pumping along, and suddenly it has all this huge influx of blood. And it goes, oh my goodness, we got to get rid of all this stuff. And so it starts pumping faster and harder, and it pumps all the blood everywhere, body as well as brain. And so you get rid of that lightheadedness very, very quickly. And that's one of the ways in which you can get rid of that sort of, again, I'm talking minimal. I'm not talking significantly lightheaded. If you're significantly lightheaded, you just get down to the ground, because if you fall, you break things and you hit your head, and it's not good. So I'm not talking to those folks. I'm talking about the little tiny bit of lightheadedness we get. And what you do is you create that suction for several seconds. Okay? I mean, you suck hard. You make the muscles hurt. You make your chest ache when you do that. You suck really hard. I can already feel my face flushing, because that blood sucks in and then it goes boom right up to your head, gets back the blood pressure, and that lightheadedness goes away very, very quickly. Again, with that one caution I gave. Now, I know that I frequently get this. My blood pressure is normally very good, but when I'm on my knees in prayer or laying down in bed and I get up too quickly, I get that little bit of lightheadedness. So what do? Preventively, before I get up, I take a few very, very deep, hard breaths, normal breath in between, then another deep breath, and do this blocked breath. And then I don't get the lightheadedness at all. I feel that flushing feeling, like you've said something embarrassing, and I get up and I have no lightheadedness whatsoever. That really fixes the problem. Now, it's hard to do, because when you don't let that air go in and you suck hard, those muscles hurt. And it takes some time and some work and effort, but it really, really works. It's amazing how we treat our spiritual lives the same way, right? When we get spiritually lightheaded, weak, kind of feeling spiritually faint, so to speak, and not very strong, we oftentimes fill it with the easy stuff. Air goes in quickly, our little distractions get in quickly, we go and do things like we eat, or we go out and do things with friends, and those are all absolutely wonderful, and they're great, because again, breathing is healthy for you. But a lot of times, to get rid of it, to really fix the problem, you sometimes have to do the things that take a little longer, take a little more work, things that take a little more effort and a little more thinking ahead. So if you pray daily, like when I take that deep breath before I get up, I'm thinking ahead, I'm going to get this problem, I don't want it. When you get into your spiritual life and do your dedication, your devotional things every day, of course, sometimes you don't get those lightheaded episodes spiritually. And when you do get those episodes, sometimes it takes stopping what we're doing, getting rid of the easy activities that distract us. Not that they're bad, they're good, but they're not as good as sitting, stopping, and doing the devotional things that really do help us spiritually. So it takes a little more work, takes a little more effort. It's well worth the effort, though. This is Dr. Keith McAfee. Thank you for listening. I look forward to talking to you again soon. I hope you enjoyed this video. If you would like to see other such video logs, please go to my website, KeithMcAfee.com. There you'll also learn about my book, Breathe, A Physician's Stories and Reflections on Prayer, published by Westbow Press, a series of 45 true stories from a medical career, and how that relates to our prayer life. Thank you very much for listening. I look forward to talking to you again soon.